Hello, my name's Nichola Cooper and I'm a consultant at the Hammersmith Hospital Imperial College, and today I'm going to talk to you about, is ITP a bleeding disorder? So, platelets are needed in order to form a blood clot to prevent you from bleeding. So you can see the tiny little platelets in the circulation here, alongside the red blood cells and the neutrophils. Neutrophils are the cells that fight infection. Red blood cells carry oxygen. The cells that line the blood vessel are called endothelial cells. And when this endothelial cell breaks, so if you cut yourself, you break into the blood vessel, then the platelets recognize that there's a break in this endothelium. You can see there's a cell here, it's a cell here, there's a break, and that's where these red blood cells can come out and form a bruise or bleed. And these platelets recognize that, and they react against collagen here that's on the basement membrane of the blood vessel. And these platelets start to get activated. They carry on activating each other, get overactivated, and some other blood cells are in the blood clot as well. And then they trigger something called the coagulation cascade, and you get this really nice blood clot here to stop you from bleeding. However, you don't need a normal platelet count to stop bleeding. So this is a test called the bleeding time, which we used to do. You'll be glad to know we don't do it anymore. Where you put a little cut with a scalpel into the arm, and then you use blotting paper here just to measure how long the bleeding lasts for until a blood clots. You can see that here as well. This is a very old study, 1972, and as the bleeding time gets longer, that means it takes longer to clot. As your platelet count falls, it's not until around 80, this is an older numerator, it's about 80, that the bleeding time starts to get longer. And in patients with ITP, that happens at even lower platelet counts. So this is a patient with other bleeding disorders, they bleed even with higher platelet counts. Patients with ITP have to have very low count before they bleed. And one of the reasons we think that happens is because the platelets in ITP are very big. So this is the size of a platelet in normal people, but if you've got ITP, then you're producing earlier platelets, and these platelets tend to be very, very big and juicy, and we think make it easier to form a blood clot. And another fairly old study showed that bleeding symptoms really only occur when the counts start to get less than 50, severe bleeding less than when the counts are less than 20. So these red dots here are bleeding events, number of bleeding events. This is the platelet count along here. And as you can see, when people have very normal platelet counts, they don't tend to bleed. The bleeding score is measured by 1, 2, 3, and 4, how severe it is. So for very severe bleeding, mucosal bleeding or organ bleeding. And as you can see, it's not until you really get down to 50 that people start getting even grade 1 bleeding, and you don't really get grade 4 bleeding until the counts are less than 10. You know the kind of bleeding that you get with ITP, so some people just get petechiae, so tiny little dots on the skin. Some people get purpura, so bigger dots on the skin. Some people get very bad bruises, which can take some time to heal, and other people get this mucosal bleeding in the mouth. And this bleeding we don't worry about. Even the bruises are annoying and irritating, but they're not dangerous. But really we try to treat if people have got these mucosal bleeding. So following on really from our understanding of how much bleeding or not bleeding people tend to have, and also thinking about treatments and side effects to treatments, whether people want treatment, this is the general algorithm we have for adults with ITP. So only really patients who've got platelets of less than 20 do we consider for urgent treatment. And this is because we think the risk of bleeding is increased, particularly in older adults, but I'll come back to that a bit later. For patients who they've got platelets between 20 and 50, they might get a bleed if they have a traumatic event, particularly head injuries can be problematic. And so we often observe or wait for these patients. And although even if you have a platelet count between 50 and 150, although you might be diagnosed with ITP or thrombocytopenia, really, majority of people really do not need treatment. So we wanted to explore that a little bit more. So if you are getting petechiae in the skin, are you getting it somewhere else? So we were wondering about this sort of cutoff of less than 20, and also, you know, whether having a higher count might make you more like have bleeding elsewhere that you don't even know about. So we did a study of 50 adults with ITP, and they all had to have had a count lower than 30 at some point in their treatment. We did a specialised MRI scan of the brain. And our results are very reassuring. So nobody with the lowest ever platelet count, so nadir count of greater than 15, had any microbleeds at all. And these microbleeds are tiny, you can barely see them. So if I go back to this scan here, where the arrow is the tiny, tiny little bleed here. So we don't think that the presence of tiny bleeds is causes problems, but there just might be a measure of how much bleeding there is. And then if patients even though patients who had platelet counts, lowest platelet counts ever of less than 15, only 50% had a small microbleed. Now, even for those patients who had much lower counts, less than 5, only 60% had a microbleed. So I think mostly this is very reassuring that in adults with ITP, unless your counts are less than 15, really, there doesn't seem to be any serious bleeding. But as your platelet count does get lower, I think that it's clear that we should be treating people. We have an ongoing study with a larger cohort of patients, which we're combining with some cognitive testing and other quality of life testing. So what is ITP about? So I'm now going to just discuss 2 reports from the Irish survey, that's an Immune Thrombocytopenia World Impact Survey, which has just recently been published. So this is a study which included over 1,500 patients from all over the world, so Canada, China, Colombia, Egypt, France, Germany, India, Italy, Japan, Spain, Turkey, UK, and the US. All had a diagnosis of ITP. They were older than 18 years and had not previously completed an Irish survey. It also included 472 physicians from, again, the same countries. And clinicians had to have a minimum caseload of 3 patients with ITP responsible for treatment decisions, time for completion, and the study aim was to address the diagnostic burden associated with ITP, to characterise the patient experience and physician perception of ITP, and to determine any disconnect between patients and physicians regarding the disease management and identify unmet needs. And a summary of this study, I think one of the biggest impacts was really understanding the amount of fatigue and the severity of fatigue that patients had with ITP. So on this part here, this is symptoms experienced at diagnosis, and this part here, symptoms currently experienced. And what you can see, this is symptom severity up to 80%, and the percent of patients reporting the symptoms. And yes, petechiae and purpura were most patients did present with this, and it was severe at diagnosis. However, fatigue, I think, was surprisingly severe, perhaps. You may not be surprised by that. Up to 80% saying it was severe, 60% saying they had severe fatigue. And later, so at the time of the survey, a lot of the bleeding symptoms seem to have gone, but the fatigue persists. And this is the symptoms experienced by the physicians reported. And you'll note that it's hard to find the fatigue in this. So actually the physicians felt that only 30% of people had fatigue. And they did appreciate that this was severe, up to 60%. But physicians considered bleeding and purpura to be the biggest concerns for patients. And I think that what you can see that physicians are very concerned about bleeding. So that's one of the things they really noticed. Whereas if you look at here for patients, menorrhagia, so heavy periods, was severe. But actually it's harder to find some of the bleeding episodes are not perhaps so noticeable. And I hope that that's because they are managing to treat it. The other thing to note here as well is thrombosis. So not many people had thrombosis, but it was severe if it was documented. I think the other thing that really came out for IWISH is anxiety around unstable platelet counts. And I think that's a big lesson that I've learned, is actually the up and down platelet counts is very stressful. And we're very keen to understand more about that from you. I think that the other thing we looked at was how much of patients the physicians understood about the fatigue. And I think, the majority of physicians did understand that fatigue is a big issue. The clinicians felt that actually fatigue was more severe when you had lower platelet counts. And again, we're very curious to know if you agree with that. And then the second IWISH study that was also published at the same time looked at other aspects. So this is the proportion of patients reporting impact of ITP on daily living. And I think it's listed in order. So of patients how many people had ITP impacted on their energy level, and you can see 42% of people had some impact on their energy level, and some all of the time, some more than half the time, and some sometimes. ITP can negatively impact normal capacity to exercise, impact on daily living, impact on working, impact on ability to concentrate, hobbies, social life, and education, supporting other people, and also in sex life. And I think what was quite striking as well is that one of the biggest concerns is people being concerned that condition will get worse, worrying that the platelet count goes up and down with no apparent reason. And certainly I think that this is a major issue, is the lack of control over platelet count. Important for me to have a safe, stable count. I often feel nervous about having my platelet counts. I feel frustrated, having to put up with my disease. I worry about my disease. Overall impact on emotional being, stressed about ITP, worried about dying. I feel helpless because of my ITP and worried that I often feel worse than the doctor thinks I feel. I often worry about my physical appearance and often wear long sleeve clothing. So again, back to, is ITP a bleeding disorder? Certainly the bleeding has a lower impact than some of the others, perhaps on emotional being. This is another striking feature, that ITP had an impact on employment status. So some people reducing hours, possibly considering terminating job, changing jobs, voluntarily stopping working. So the impact of ITP is, as you know, big. Also the impact of ITP on regular activities. So this is divided by age. So red is greater than 50 years, yellow is 18 to 49 years, and the top is completely prevented activities, the bottom is having no effect at all. And I think you can see that a lot of people, it is affecting their regular activities. And this is a curious difference as well. So if you look at patients with ITP, so these are the frequently selected treatment goals by physicians. Sorry, this is the treatment goals for patients. So the patients, so you, where more than 30% were selected in the top 3 goals, or more than 5% were collected as the main goal. So healthy blood count was the top 3 goals, was in 64% of people, and was the main goal in 35%. So healthy blood counts was the first prime motivator for treatment. preventing worsening of my ITP, also very high, and then increasing energy levels, improving quality of life, and reducing my spontaneous bleeds and bruising was a lower objective, so 38% or 14%. And I wonder perhaps whether that relates to actually not having much bleeding, but worrying more about the bleeding. And in contrast, the most frequently selected goals from physicians was really a reduction in the spontaneous bleeds. So for physicians, 72% of people had a top 3 goal of reduction in spontaneous bleeds. 64% wanted patients to have a better quality of life. 51% were looking for a healthy blood current, and 35% symptom improvement. 26% of patients having slow or delay the progression of the disease. So in summary, ITP is a bleeding disorder, and particularly if your platelet count is very low, and certainly I think the bleeding and the bruising can be very problematic for some people, but it's more than just bleeding, and certainly fatigue, problems with concentration are also a big impact that we do understand for patients with ITP. And what we've concentrated on so far for all of this talk is really adults with ITP. And for those of you with children who are children with ITP, it is different because you know that we don't treat quite so aggressively. So we're also now doing a further study to look for children over 7 years old, at least a count less than 30, and we're doing our MRI scan. Again, unless please do contact us if you'd like to take part of it. And thank you very much for your attention.